Hi everyone. How are you? I hope you are all in good health. Today, we will learn about a condition called hydrocephalus, which are one of the topic under the field of pediatrics. So, allow us, Insyirah Mera binti Shaul Iswan with matric number 075157 and Nuralia Insyirah binti Muhammad Raslam with matric number 076093 to present this topic. So, here is the outline of our topic, which include the introduction, etiology, pathophysiology, clinical features, medical and physiotherapy management. Hydrocephalus is the buildup of cerebrospinal fluid in the brain's ventricles, leading to increased intracranial pressure and potential brain damage.
The etiology of hydrocephalus refers to the underlying causes or reasons why cerebrospinal fluid, also known as CSF, accumulates abnormally within the brain's ventricles. These causes can be classified broadly into congenital and acquired.
For the congenital, we have the neural tube defects, aqueductal stenosis, also the genetic syndromes. First, the neural tube defects, which is a group of birth defects in which an opening in the spine or cranium remains from early in human development. In the third week of pregnancy, called gastrulation, specialized cells on the dorsal side of the embryo begin to change shape and form. The neural tube, the spina bifida, and encephaly and craniorachis are the example of neural tube defects. Second, the aqueductal stenosis is a narrowing or blockage of cerebral aqueduct, which is a narrow channel that connect the third and fourth ventricles in the brain. Because of that, the normal flow of CSF is disrupted, leading to a buildup of fluid within the ventricles, causing them to enlarge, known as hydrocephalus. Last, for the congenital part, is the genetic syndromes such as the Apert syndrome, Dandy-Walker syndrome, and Crouzon syndrome. And for the acquired, we have the infections such as the meningitis, brain tumors, and the intraventricular hemorrhage. Before we go through the pathophysiology of hydrocephalus, we need to know the normal mechanism of the CSF, including the production and the flow of the CSF. So how the CSF is produced and circulate. Let's see the video together.
Cerebrospinal fluid, or CSF, is produced by the choroid plexus in the lateral ventricles of the brain. From the lateral ventricles, the CSF flows through the interventricular foramina to enter the third ventricle. Here, a second choroid plexus produces more CSF. Next, the CSF passes through the mesencephalic aqueduct of the midbrain and into the fourth ventricle, where further CSF is added by a third choroid plexus. From here, it passes through the median aperture and lateral apertures into the subarachnoid space. Finally, the CSF circulates down the central canal of the spinal cord and around the brain and spinal cord in the subarachnoid space.
Now, we may go to the pathophysiology of hydrocephalus. The hydrocephalus is caused by an imbalance between the production and absorption of CSF, leading to accumulation on CSF in the brain's ventricles, which cause ventricular dilation and increased in intracranial pressure, also known as ICP. The pathophysiology of hydrocephalus depends on the types of hydrocephalus. First, the obstructive or non-communicating hydrocephalus that caused by blocking in the CSF flow within the ventricular system. It is usually happened in the aqueduct of Sylvius and foramina of Monro. The example of the obstructive hydrocephalus is the aqueductal stenosis, tumors or cysts that blocking the ventricles. Second, the communicating hydrocephalus, which happen due to impaired reabsorption of CSF by arachnoid villi without physical obstruction. The examples for this type of hydrocephalus is the post-meningitis and subarachnoid hemorrhage. This type may cause the pressure increase or not increase. Third, the hydrocephalus ex vacuo that caused by loss of brain tissue due to the trauma or stroke. Because the ventricles appear enlarged but not due to increased CSF pressure, and it is not a true hydrocephalus, so no treatment is needed. Last but not least, the normal pressure hydrocephalus, also known as NPH. It is common seen in elderly population. In this type, the CSF buildup slowly lead to ventricular dilation without significantly raise the intracranial pressure. The classic triad may include the gait disturbance, dementia, also the urinary incontinence.
Now, let's move on to the clinical features of hydrocephalus. First is the enlarged of the head size. Second is bulging of the fontanelle. Lastly, sunset eye sign. What is the doctor treatment for hydrocephalus? For medications, acetazolamide or furosemide are given to the patient to reduce the production of CSF temporarily. Surgical treatment includes ventriculoperitoneal (VP) shunt, a tube placed in the brain to drain excess CSF to the abdomen. Endoscopic third ventriculostomy, ETV. A small hole is made in the floor of the third ventricle to allow CSF to flow normally inside the brain. Medication can only manage symptoms temporarily, while surgery addresses the underlying cause of hydrocephalus. VP shunts and ETV are the primary surgical treatments. Lastly, let's move on to the physiotherapy treatment. The goals of physiotherapy treatment is to improve mobility, enhance motor skills, and promote patient independence. First is positioning and handling. Proper positioning and handling help prevent deformities and promote optimal body alignment. It supports muscle tone, improves comfort, and aids in feeding, breathing, and interaction. Second is range of motion exercises. These exercises help maintain or improve joint flexibility and prevent stiffness. Passive or active RM exercises ensure that muscles and joints move through their full range. Third is strengthening exercises. Targeted activities to improve muscle strength, particularly in areas weakened by hydrocephalus. This helps children gain better control over their movements and support their posture and mobility. Lastly, neurodevelopmentally technique. Therapists gently guide the child's body with their hands to teach them how to sit, stand, or move properly. This makes it easier for the child to do daily life activities like playing or getting dressed. Thank you.